Director of the Oregon Health Authority. We have Jennifer Vines, Dr. Jennifer Vines, Tri-County Health Officer, and Dr. Dean Seidlinger, who is Health Officer and State Epidemiologist.
Thank you. Good afternoon, everyone. Thank you for being here this evening. This afternoon, we learned that we have Oregon's first case of the COVID-19 coronavirus. Earlier this week, federal health officials advised Americans that new cases of the COVID-19 coronavirus were likely to occur. That is why I directed my agencies to continue more active preparations. And that's why today I stood up a coronavirus response team to coordinate these efforts statewide. I understand that this news is concerning. However, I want to reassure you that our state and local authorities are responding quickly to the case. They are professionally trained to handle this situation. Oregonians should know that we are taking this very seriously. Officials will provide immediate updates as we have them. With that, I'll invite Oregon Health Authority Director Pat Allen to give more specifics and what next steps our health professionals are taking. Thank you very much.
Thank you, Governor. First, I want to acknowledge that there has been a great deal of concern around the world and here in Oregon about the COVID-19 coronavirus, and that concern is real and reasonable. As the governor indicated, we've had our first presumptive case of COVID-19 in Oregon. What does that mean? That means that the individual who was under investigation had a test done, and that test was returned positive. That test was done by the Public Health Laboratory here in Hillsborough. Earlier today, we were doing a variety of briefings about our preparedness, and at that time, that capability wasn't yet online. It actually came online during the day today, and so it was able to be deployed and provide that test. We'll do a confirmation test through the Centers for Disease Control and Prevention in Atlanta, and so the case will be considered presumptive until we receive a confirmation one way or the other. The case is from Washington County, and the individual is currently at Kaiser Permanente Westside Hospital. In the interest of privacy, we will not be disclosing the age, gender, or specific condition of the individual. Nevertheless, our concern is certainly with that person and with that person's family, and we want to provide all the support that we can for them. There was no known travel exposure for this individual, so this is a case of community spread of the disease, much like the case from California earlier this week. The patient has spent time at the Lake Oswego School District at Forest Hills Elementary School. We're working with the local school officials and the Oregon Department of Education in the response. We're also working with Washington County and Clackamas County Public Health Authorities to conduct contact tracing to notify people they may have been in contact and offer health guidance. We're also providing guidance to local healthcare providers to help them respond to inquiries they may expect to get from parents and other community members. We've notified the Centers for Disease Control and Prevention and are working closely with all of our local partners. What we don't know the number of close contacts being within 6 feet for a prolonged period of time that this individual had. We don't know how this person became infected with COVID-19. It's too soon to say what impact this case has on family, friends, coworkers, or the Lake Oswego School District and other members of the community. Contact tracing is our top priority right now. We'll notify the public as soon as we receive any information about potential exposures. What are we doing? We will notify anyone who is likely to have been exposed. We're continuing to process COVID-19 tests as necessary at the Oregon State Public Health Lab. Earlier today, we identified that there were 2 individuals under investigation, and so we're testing that other individual. We will announce any individual positive test results when we become aware of them. What can you do? The advice is actually pretty simple and has been around for a long time. Cover your cough and sneeze. Wash your hands. If you begin to have symptoms of a cold or flu, it's critically important that you not go to school or go to work. Stay home and call your healthcare provider for guidance. And stay informed. The OHA website, healthoregon.org/coronavirus, has a variety of information pieces for individuals and providers. And the 211 information line is equipped with information to answer inquiries that you might have. We spent a lot of time today at the Capitol and talking with you all about preparedness for this event. We've been expecting this and we're prepared for it, and we're using the system that we described today to respond and help keep Oregonians safe. Now I'd like to turn it over to Dr. Vines.
Good evening, everyone. I'm Dr. Jennifer Vines. I'm a family physician, and I'm the lead for the Tri-County Health Officer Program. That's Multnomah, Clackamas, and Washington counties. I also want to acknowledge the seriousness of this first case. I want to let the family of this ill person know that our thoughts are with them, and I want to acknowledge the public concern that we've been planning for and working hard to address the last several weeks. I would also commend our colleagues at Kaiser Permanente for alerting us to this case and for treating this person and looking out for their frontline healthcare staff. So I would say that we are early in our investigation of this case. We are working tonight and through the weekend to determine where this person spent their time, who may have had close and prolonged contact with that person, and who will need health education to be on the watch for symptoms. We do know this person spent time at an elementary school in Clackamas County. We don't yet know exactly the risk of that the time there poses to those students. But my colleague, Dr. Sarah Present, the Clackamas County Health Officer, is here tonight. She's in direct touch with the school district, and they'll be announcing their next steps shortly. So this is your local and state public health system prepared and doing what we do, which is identification of cases, identifying people who may be exposed, and making sure they have the information they need to stay well and stay safe and keep the rest of us safe. So again, the things for it all to do are cover those coughs and sneezes, wash your hands, and now is a good time, like ahead of any potential emergency, make sure that you have a plan for your family, that you have food, medicines, pet supplies for at least a couple of weeks, have a plan for childcare should you need it, and know what your employer's sick policies are so that you can stay home at the first sign of symptoms. So thanks. With that, I think, are we taking questions?
I guess, can you go over again this, so you're calling this person a Washington County citizen, is that correct, this individual?
Washington County resident.
But spent time at Forest Hills Elementary School in Lake Oswego?
That's correct. The person lives in Washington County and spent time in the Forest Hills Elementary School. We're trying not to be any more specific than that in the interest of patient privacy. Yeah, it's an adult.
And is this patient still currently at Kaiser?
I can't comment on their current treatment or health condition.
Hospitalized?
Yeah, they are still hospitalized.
And when you say presumptive case, is it presumptive until these tests come back from Atlanta?
Right. We're getting our positive test result confirmed. If the test comes back from Atlanta positive, then we'll stop calling it presumptive and say it's a positive case. But the guidance from CDC is we should treat a presumptive case as a case until we have any further information.
Can we differentiate between the term hospitalization and quarantine? This isn't a quarantine, this is a hospitalization.
Correct.
See how long you expect it will take to get those results back.
Very shortly. We're having them expedited, and it could be over the weekend, and we'll provide that information if it is.
Elementary in Lake Oswego. Spent time there, and then also an elementary in Clackamas County.
Forest Hills Elementary is in Clackamas County.
Okay.
Do you expect a Lake Oswego School District to come out publicly with some sort of plan tonight?
Yes.
Yes.
Obviously, since you guys sent the notice to us about this, social media, everyone getting anxious about all this. What do you tell them? I mean, people are obviously concerned.
Yeah. So what concern is completely understandable.
I'm going to jump in here right now because we do have it confirmed in the newsroom that the Lake Oswego School District has announced that the Forest Hills Elementary School will remain closed through Wednesday. So we have it confirmed that Lake Oswego schools the district is closing Forest Hills Elementary School through Wednesday. They say it is a school district employee who tested positive. Let's listen in once again.
First sign that you have symptoms of a cold or the flu, you should stay home.
I'm going to add something. I just want to reassure Oregonians that we are taking this very, very seriously. I also want to encourage Oregonians to go about their daily lives, to stay calm, and as Pat and the doctors have mentioned, to take appropriate public health safety concerns, including covering your mouth when you cough or sneeze, using a tissue, washing your hands thoroughly, and if you're sick with the flu or a cold, to stay home from work or from school.
Governor, were you aware of this presumptive case when you announced the response team this morning, or is this kind of really new within the last couple of hours?
I was not. My team learned of this case at about 3 p.m. this afternoon.
You're trying to keep the person's privacy. What city in Washington have they live in? Or a general area?
Cannot.
Can you say any more about why they would ask you to get parent?
I'm sorry, we cannot.
Any idea how many people we're talking about that you are attempting to locate?
Dr. Vines.
Yeah. So I would say we are early in our investigation. We have people working on this literally as I speak, and we'll be working on it through the weekend to identify those who had close and prolonged contact with this person and may be at risk for transmission.
And you can't comment on how they're responding to this illness, what their condition is. Is it mild for them, or is it more serious?
For who's patient? No, we're not seeing anything other than hospitalized.
Once again, you said this is a community transmission event. Can you talk about what that means and how
Sure.
that's different from some of the other cases we've seen nationally?
Sure. So what we know so far is that this presumptive case does not have travel to any of the known affected areas in the world that have coronavirus transmission ongoing. That leads us to conclude that this person acquired this infection here somewhere in our community. So that's how we call it, presumably a community acquired case.
So they didn't take a plane or anything like that.
As far as we know right now, that is correct.
So if they got this from the community, then do we assume someone in the community or someone else that has it? Or how does, right?
Right. So that's the question that we need to answer. And as we identify contacts, and in particular, as we identify people with close contact, ask them to watch for symptoms. If they develop symptoms, they would become candidates for testing, and we can start to get a better sense of how contagious this disease is and what is the range of symptoms that people have with this virus.
Do you think this is going to get a little more concerning before the latter? I mean, obviously there might be someone else, and then you mentioned a second patient. It looks like we might see an increase in numbers here.
I think that's possible, especially now that we have local testing capabilities, which is a real asset to our public health system, to have the state public health lab able to run this test. So the case count may very well tick up. And again, that's public health doing its job of confirming cases in people who've had a known exposure and who develop compatible symptoms.
Were you guys aware of the rumor circulating that somebody with coronavirus was at a Kaiser Permanente facility?
Is that from several days ago?
Several days ago, yes.
Yes, I was aware, and I helped dispel that rumor.
Well, now that we're hearing this, is that the case that people were talking about, or is this something
No.
different?
No.
Now that it's here, we had heard of the California case in Northern California where testing from the CDC wasn't being done as quickly as they would have liked. Has that ramped up? Have national officials reassured you that if we have new potential cases coming in, that they will be tested quickly, so maybe this can be isolated?
So, just to add, the Centers for Disease Control this week, after that case in California, did expand the number of people who would be tested. So the people with serious respiratory illness who are hospitalized, even without a...
All right, we're watching live coverage now, and just want to jump in because we have some updated information, some information that they're not providing at this news conference, and that is that the Lake Oswego School District has sent out an announcement to parents saying that the Forest Hills Elementary School will be closed through Wednesday.
That's right. They need to deep clean everything. They want to make sure that they're covering all, make sure that they're being safe, because really this is the beginning of this investigation. So we really don't know exactly how this person got the virus. They're saying that this person did not travel anywhere recently, so they do believe that they got it, somehow locally, which is concerning.
They call it a community transmission. Let's listen back into the news conference.
Tonight and through the weekend to identify who this person has contact with, so we can try and draw a tight circle and see the people who are at risk, identify them, assess their symptoms, see if they need to be tested. If we do notice spread in our community or multiple cases, that is certainly something we would consider on a case-by-case basis if the situation escalates in Oregon.
How quickly can you ferret that out? Like how, you've probably done this before with different illnesses. How quickly do you guys move? When will we know the amount of spread?
So when we know of a case, you will know shortly after us. We identify a case. We've been doing this continuously with our persons under monitoring who come into Oregon and already cleared about 180 of those people who did not develop symptoms and are now in our community with no threat at all. We have additional Oregonians who've been very compliant and working with our local public health officials and staying home, talking about their symptoms and reporting things. We've had 2 people prior to this who developed symptoms when they were under monitoring, were tested, and those came back negative. So we have the utmost confidence that people are complying and listening to public health. We know there's a lot of concern out there, and that's why we are announcing this case, even though we don't have all the information, because we want people to be assured that public health, the state, our federal partners, our local partners are working together to do everything we can to ensure people are protected.
Is this person self-quarantining or not self-quarantining, but they're in the hospital?
This person is in the hospital and is isolated.
What about the members of that you know have come in contact with them? That you don't know if they have it, but have you asked them to kind of...
So our Kaiser Permanente, our healthcare partners are working very hard on making sure that their staff are protected and taking the steps they need, and our local public health partners who are working with potential close contacts, including this individual's family, are also assessing to make sure that people are taking precautions and not exposing others.
Is there concern over other areas in Washington County where this person could have spent time? I know you mentioned the school, but is there any other areas that you guys are looking into where this person could have spent time that is posing a risk to others?
Mm-hmm. So that's a great question. Part of the local public health response is to do a detailed timeline of where the person was during the period that we think they were most infectious. So again, that's happening literally as we speak, and we account for pretty much every minute of the day in an important potential exposure like this one. So again, we're looking more for close and prolonged contact, but we are making sure that we do our best to capture anyone who may be at risk and needs to know that they've been exposed.
Dr. Vines, can you explain again the second person you guys are? Is there another person that's being tested? You're waiting for those results to come back? You mentioned that you don't know about the second.
Yeah, so we committed to doing weekly updates, but since we're here, there's another individual who has developed symptoms and would fit criteria for testing by the CDC. Those results are currently pending, and if those results come back positive, we will certainly confirm those as soon as we have that. To confirm what Dr. Vines said, we work on these prolonged close contacts for these investigations to identify who's at risk. This is not like a measles investigation where even kind of being in the same room with someone or after someone would put you at risk. It does really require kind of being close, having a conversation. Passing someone on the street or in the store isn't going to put them at risk, so that's why we want to reassure Oregonians are safe, as Governor Brown said, and we will work to identify those individuals who had close contact with this person so that we can assure that those individuals are safe and are able to take the steps they need to protect themselves and their families.
Just to clarify, that second person you're waiting on those test results, they were in contact with this confirmed case?
There's no connection between these two.
I just wanted to add real quickly that, and the governor mentioned this as well, you guys literally got information about this within hours of the time that we did, and we're committed throughout this, if there are subsequent cases, to continue to maintain as high a level of transparency as we can. That means there will be times where there are a whole bunch of questions that we can't answer about the individual, but we want you and we want the public to have information about positive cases as quickly as we can.
Mr. Allen, do you fully expect more cases to pop up in Oregon given this incident?
Well, I think the CDC has indicated that they think there will be widespread incidence of the disease, and I don't have any reason to disagree with that.
You're also saying that right now you say that the exposure for people who's low risk, that people should go about their lives, go places, do things.
Yeah, I might actually rely on Dr. Dean to comment on that a little bit, but this is not a disease like measles, where the virus persists for long periods of time after someone's left. It requires close, prolonged contact, and that's a different circumstance than some diseases that we look at.
Dr. Dean, do you want to add anything to that?
Yeah, I think this is the conversations we have every flu season. You know, the reason we talk about people with flu staying home is one, so that they can recover, but two, the people that they work with or when they're in school, that they're sitting across from having conversations, those are the people most at risk. So if they separate themselves at home, they're not going to put other people at risk. Diseases have very different ease of transmission from one person to another. Something like measles is incredibly good at spreading from one person to another person, and that's why we identify public places, supermarkets, airports where people may have been, so that if people develop symptoms, they can take action. We also, in a disease like TB, it's very hard to spread from one person to another, so we usually have very limited people who are at risk. This is something in the spectrum between tuberculosis and measles, but really closer to tuberculosis. It requires someone to be within about 6 feet.
No, it's not. That's a
person to be
lie.
coughing or sneezing to have those particles affect the healthy person who's with them to get infected. Unfortunately, what we don't have with this disease is a vaccination to prevent it like we do with the flu. It is still not too late to get your flu shot, and we remind you that flu is still circulating in the community, so someone who develops these symptoms of fever and respiratory infections may have the flu, and there's something that they could have done to protect themselves and their family by getting that flu shot. So
Doesn't
get your
cover
flu
every
shots.
flu.
Governor, can I ask you, are you confident
Anyways.
with what's going on nationally to address the coronavirus?
Look, at least the work, I am very confident about the work happening in Oregon. We've handled these situations before, the Ebola virus, the H1N1. We have very well-respected, trained public health professionals, and I'm confident both in terms of our ability to handle the situation in Oregon and that we have the resources needed. I just spoke with Senator Merkley about a half an hour ago. He is working with his Senate colleagues right now on legislation to provide states with additional resources to combat this virus. And so I look forward to seeing that work get done in Congress.
One more question? Two more questions. Two more questions. One more question. Not right now, no.
When do you expect another update? More like, say this person gets the second set of tests comes back, will we?
As soon as we have additional information, we will update the public.
This weekend, if you get a positive result,
Yeah,
We will-
We won't wait till Monday.
We will update the public as soon as we have additional information, regardless of the weekend.
Just because you guys are here, I mean, just to read, it says the individual is employed at a school in Clackamas County and may have exposed students and staff. The school district is planning to close the school to allow public health officials to complete their investigation, including contacting employees there and family and children to inform them of their exposure and let them know the next steps.
I think, as we said, as Director Allen mentioned, we wanted to get this information out as quickly as possible, and obviously, over the course of the evening, you're going to see additional information coming out to assist the public in decision making.
Thank you.
Thank you.
You've been watching live coverage.